everybody.
Hi.
I think
we're back. Turns out.
Are we live?
Yeah.
Oh, there you are.
And here come friends. Yay, welcome
Hi,
friends.
Oh, Deanne's the winner. She's the
Oh,
fastest.
she is. Oh, Destiny, you're on there.
I know. She beat me.
Yeah, Deanne gets the prize today for being first on. Good job, everybody. Oh, there's Jake, Rita, Jessica, Blaine and Lisa, Nancy. You guys are so good to us. We haven't scared everyone away yet.
Not everybody.
Just like some at this point.
I think they're just waiting for what we're going to say next.
We've kept it up this long with no like real profanity. So I think there are bets being taken. Plus it's like rainy and no one's gonna, ooh, there's lightning. No one's gonna do anything cool right now anyways because it's stormy.
It's stormy.
So you might as well be in listening to us.
Get you a cup of cocoa and sit down. Hi, sister.
Hi, sister. Hi, Lori.
Yeah. Get you a cup of cocoa and have a seat.
Yes.
Learn
As
something
Destiny
interesting.
says, get you a cup of cocoa. Is that
Cocoa.
Is that like hot chocolate? Is that
It's cocoa.
Mm-hmm.
If I could poll people, I would, and they would say cocoa.
Feel free to chime in if you feel like if you're a cocoa sayer or a hot chocolate sayer. Hey, Jace. Hi, Jace. Alrighty. Okay, you guys. Well, we've got about 50 or so people on here, so I guess we'll get started. Yep. There is a current poll out there, whether you say cocoa or hot chocolate. Feel free to chime in. Very important. Thanks, Janae.
Janae, you have no idea what you're talking about.
She's a pharmacist. Oh, we've got 2 pharmacists on here. That's exciting. Good stuff. All right, you guys. Really great to see you all. Not that we can actually see you, but we see tiny, tiny little circles with your faces on it. So we're going to pretend like you're here with us. We're giving you virtual hugs. And I am Jennifer Bacani McKinney, and I'm the Wilson County Health Officer.
I'm Destiny Wheeler. I'm the Health Department Administrator.
And here we are again.
Yes.
Our Tuesday Facebook Live where we answer your questions and we try to give you good information. And we do informal polls, like whether you think it should be cocoa or hot chocolate. And by golly, hot chocolate is winning.
I know. I only have one vote. No.
We're getting there.
I have 3.
Hot
Thank
cocoa.
you.
It's like a combo. Wow. All right, you guys.
Okay.
So, first of all, we have new shirts. They're actually matching shirts today.
We do.
So we're going to show those. All right.
Viruses are jerk.
People shouldn't be. So what we were meaning to say, and we've said this jokingly on previous Facebook lives, and what we mean is take care of each other because this is a hard time for everybody. So please
Just be nice.
be nice to each other and look out for each other, check on each other, and make sure everyone's doing okay through all of this. All right. Do you want to do numbers?
Yes,
I think that
let's
sounds
do numbers. Okay, so we still do not have any new cases in Wilson County, just one, and she is recovered. We have 3,491 cases in the state with 125 deaths. Yeah.
All right. Sounds good. And so we are trying to help kind of frame it also and give you a little idea of where we are, where we've been. You know, we talk each week about how the testing works and, how many negatives we have, how many positives. We are still at this point testing symptomatic people. We are getting more tests in Kansas. We've been, I say we like I'm up there doing it, like Kansas has been 3D printing new swabs so that we can do more testing, and they're making their own transport medium. So lots of cool things, lots of swabby nerdery happening, but for the good of Kansans to make sure that we can do all the testing that we need to do.
Yep.
What do you want to talk about? Do you want to mention recovered cases just in case people have questions on that?
Yeah, I've had a couple conversations in the past few weeks about recovered cases and why we're not reporting those. Obviously, we have just had the one case, so we are reporting that we have one recovered case, but the state is not reporting those numbers. And when we ask KDHE about that, they let us know that somewhere around 15% of health departments are filling in the date recovered box on the disease reporting software. which does not give us anywhere near an accurate number. We know, we are pretty sure. We are reasonably sure that we have more than 15% of cases recovered, because we do know that the majority of people are going to have a mild illness. I looked it up today, and the World Health Organization says that the illness, when it's mild, lasts about 2 weeks. So most of those cases that we were seeing at the beginning that did not progress to serious illness have probably recovered already. We just can't give you that accurate data.
And we don't want to report data just to report data, because we want to only report accurate data. So
yeah, if we say 15% of people have recovered, that's only like 500 cases since the beginning, yeah. And we don't feel like that's accurate. So we don't want to do that.
All right. So just a feel good. Sorry. Yep. All right.
Allergies.
Everyone looks really good, just like pre-sneeze. So this phase is going to be really great. Well, hopefully a friend at home screenshotted that. So, anyways, a feel-good story, if you guys heard already, was that we had a Kansas couple who made the news that sent an N95 mask. This is just kind of one of the headlines, an N95 mask to Governor Cuomo in New York, and they just wanted to make sure that they could help at least one person. And we think this is really great because he mentioned, how beautiful is this? It's selfless, and it's just a great display of what it means to be a Kansan. And no offense to people who aren't Kansans, lots of people on here are Kansans, or used to be, or want to be. I don't know about that, but it's just really cool, because one of the things that we've been able to witness, and I hope that all of you have been able to witness, is that this challenging time has really brought out the good in a lot of people, and we're seeing such giving and generous, kind hearts being displayed. So thank you guys for everything.
Yes.
Hopefully also you noticed today that right before this, we're so excited.
Yeah, we didn't even know when it was coming on.
Yes, but we recorded earlier our session with Secretary Norman. We would have liked to share with everybody before it happened, but it's on the KDHE website and on our pages also. We shared it. So So we had this two-on-one session with Secretary Norman. He has asked us questions about how things are in rural communities, and then we asked him questions. And so
yeah, it was great. It was a lot of fun. And
we feel kind of cool.
Yeah, they did something to our skin to make us look
really
nice.
Good.
So it was sorry about this quality.
Yeah, some sort of filter, like a Secretary of Health filter.
Yeah,
I think
something like that to make us look more lustrous.
Now, our Secretary of Health, little known fact that he is in fact Colonel Sanders, and so we actually asked him if what his preference was, original recipe or spicy chicken. So you'll have to tune in to see what he said. It's at the very end.
It's at the very end.
Dun dun dun! So much suspense tonight. We don't even know.
Yeah. So one of the things that he spoke about, that we asked him about, was the peak, because I've had a couple questions too come in saying, well, how are we close to the peak when the cases are just going up so rapidly? One of the reasons that the cases are going up so rapidly is because we have more testing capabilities now, and we all know that there are outbreaks in food packaging plants and stuff. I think did we talk about that last week?
I think the numbers really went way higher this weekend, so we might talk about that some more.
Yeah, maybe we talked about it Monday.
Oh, yes.
On our Monday meeting. Sorry, so many virtual meetings. But so we know that yes, those cases are going up, but I think part of that is because we have the enhanced testing, and we can test more people. So the more people you can test, the more positives you get. And also we have identified them, not we, but the state has identified them as a cluster.
We'll take credit. It's fine.
Yeah. And Dr. Norman did mention on yesterday that they were seeing a lot of cases, but they weren't seeing a lot of serious illness. They were not seeing really any hospitalizations, and they were not seeing any deaths out of this yet. So so the severity of the cases is not as high. So as
At this point.
at this
anyways,
point,
yeah.
yes, at this point anyway. So we're seeing a decreased trend in new cases of hospitalizations. I
Yes.
said that funny.
Decreased trend. Yeah, a decreased trend.
A
Yeah, we'll figure that one
decreasing
out
trend
later.
in
We'll
new
get back to you.
hospitalizations every day. How about that?
Yes, I like it. Okay.
And the same with the deaths. They are decreasing trend. So.
And one thing, with testing and everything, we are going to see, we will likely see more positives. We'll also see more negatives. So really what we look at is the percent of positives that we're seeing. So we always have to take that into account, what the testing tells us, and take all of the information with it. And hopefully that's going to give us a better picture of what we're actually dealing with. We know that our numbers are by no means, anywhere in the United States, are by no means exactly right. And so we're just trying to use our best information that we have, but we have to use only that information that we have. And so that's why we have to watch positives, negatives, all that, and our death rates, and see what that tells us.
Yeah.
So that's exciting. We talk about death rates very uplifting. Let's talk about staying home. Yeah. No, we do know that is the hot topic, and people are wondering because the stay home mandate, it does expire on May 3rd at 11:59. Some people have said May 1st. Some people said, well, I thought it was, we thought it was going to be May 1st that day. We're free. So we're going to talk a little bit about that and what it means. And to be honest, just to preface everything, we don't know exactly yet. That we're watching what the state guidance is, and so we're trying to figure out what they are going to set forth, and then we're going to model our county's guidance off of theirs, but also take into account that this is Wilson County. We're not Wyandotte County. We're not Sedgwick County. So we're going to do our best to help our citizens as much as possible, because we know, as we've said a lot, we know this is challenging physically, mentally, and financially for people, so we're going to do the best that we can for all of you guys. So, stay home mandate, May 3rd, 11:59 is when it expires.
Which is Sunday night. So everything new will start Monday morning. We know a few things. The state is not giving us, like Jen said, they're not giving us a lot of information, but they're giving us some tidbits of information. So we know a little bit. I do want to say that Jen and I, and we sat down for a long time on Saturday.
A long time. It was a marathon.
And made up an opening Wilson County document. We got with the mayors in Fredonia and Neodesha and kind of ran it by them, got their input, what did they think? We adjusted some things. We're not done with it by any means. It is still a draft. And it has to it's pending whatever the governor's guidance is. So like I said, it's nothing that we can roll out now, but
and it's nothing we're trying to
we've worked really hard
not
on
share with you, but yes, we worked really hard on it, and we're every day we're looking at it and taking the guidance from the state and deciding how we might need to tweak it more to go with what the regulations are in the state. We can't be more relaxed than the state. We have to be as strict as the state. We can be more strict, but again, we are taking into account what businesses we have in Wilson County and where most people are employed and what activities we do here, which is not the same as we see in urban areas. Now, having said that, we have been sharing amongst the health departments and county health officers different reopening documents in different counties. So we're taking in that information as well. So we're also not making it up from scratch, but we will say that we've kind of been some of the well, if it's okay, we're going to brag on ourselves. We've kind of been some of the leaders in Kansas as far as setting down on paper what reopening looks like, and just saying, here's some thoughts, here's some ideas. What can we do? How do we edit this? How do we make it better? And that's been shared all over. And so it's really cool seeing the teamwork throughout the entire state to figure out what's best for everybody.
Yep. Yeah. So a couple, one more thing that we know is that after the stay-home order, which is an executive order, after it ends on May 3rd, there will be a new executive order on May 4th. They have divided this they, being the governor's office, have divided this reopening out into 4 phases. They just call them phase 1, phase 2, phase 3, and phase out.
Phase out, yes.
Yeah.
Like phasers on stun from
Phasers set, phasers to stun.
Yes.
Mm-hmm.
That's some good stuff. I feel like that's solid right there.
I think so too. I'm proud.
Yes.
I'm proud. Everything is in 14-day increments, which is how we kind of looked at ours too, because of that incubation period. Now, it doesn't mean every 14 days something new happens. It means that every 14 days we reevaluate where we're at and what things are looking like to see if we can reopen.
And if in the middle of that 14 days, like day 7 of phase 2, if we see like a peak or something and we a spike in our numbers in Wilson County, then we might say, okay, we've got to stay here at this phase. Or even if it's really bad, potentially go back a phase. So that's why you're going to see reopening at the beginning is kind of slow. I mean, we do want to get people out there doing kind of normal things, right? But if we jump out right out the gates and we say, okay, everybody just do whatever you want to do, go back to work, yada yada, then we're doing you guys a disservice, because that means that we're going to end up right back in a stay-home order, or we're going to end up with multiple cases when we could have prevented that. So if you're antsy and ready to get back out there, we get it, because we are too. But we are doing this in a way that's safe for everybody, so that we can stay in those phases and keep progressing to the next phase and to the next phase. What was another thing with phases? We are going to be addressing, so it's, again, not just like a blanket statement of, some businesses can open, some can't, or whatever. We are going to address things like, parks and public places, and essential businesses, of course, and personal services. We know there's been a lot of questions about salons and barbershops and pet grooming even. And so we're going to try to address everything that we have in Wilson County so that we have answers for you. And we want to be very thoughtful about that. So we're trying to meet with business leaders and church leaders and, our school officials, and try to figure out what everything looks like.
Mm-hmm.
Oh, I thought of something earlier. Okay, hold on.
I did too. I
I
should
know.
have written it down.
So one thing to remember too is that the CDC, sorry, this doesn't have to do with staying home, but I just remembered. The CDC, they now officially have added more symptoms to their symptom list. So before we were telling everybody, if you've got a fever, cough, or shortness of breath, that's what we call symptoms of COVID-19. But now we have symptoms that include, okay, here we go. All right, ready? Everybody ready? Get a pen and paper down? There will be a test shortly after. All right. Fevers, chills, shivering, muscle aches or myalgias is the way we call that. Malaise, which is kind of a general feeling of discomfort, pain, or not feeling well. Headache, sore throat, still cough, shortness of breath, difficulty breathing. A change in or lack of taste or smell, which has been something that people are seeing around the world. We also add in diarrhea, which is not explained by a more likely cause. So, if you went and, ate something that you shouldn't have eaten, that's probably not coronavirus. So that's why we add that as in that there will be, there needs to be not another cause of the diarrhea. Sorry, I was told there would be no test. Yes, Jennifer Price, there will be a test. That's how we roll here in Kansas. I don't know what they do in New York there.
So there's a question about being able to test and see if someone has had it. At this time, KDHE and I know Jennifer and I are not recommending those tests. They're called antibody tests. We've looked into it. We've researched it. What they're finding is that these tests aren't regulated by the FDA, so there's that.
Some are.
Some are.
Yes.
But they say that you've had coronavirus, not necessarily that you've had COVID-19.
Right.
So other coronavirus will react. So say I had a cold last winter.
Caused by coronavirus.
Caused by a coronavirus that wasn't COVID-19. I may still come up with antibodies for coronavirus that would register on the antibody tests.
And we do really desperately hope that we can start doing antibody testing soon, because we do need more answers and do need that ability to say, yes, this person is immune, or this person did have it, and be able to feel secure in what that means. But again, just like we mentioned earlier, we're not going to give data that's incomplete or data that might be misleading. With antibody testing, and just for a review, because I like the really nerdy reviews of antibody testing, because if you're going to pay for college, you might as well spew out something you learned. But so antibodies are proteins that your body makes, your immune system makes, to fight off disease or prevent disease. And so it's supposed to happen that antibodies are created when you are exposed to a disease, or if there's a vaccine that you get. So in this case, we don't know, because COVID-19 is so unique, it's a new mutation, we don't know exactly how the body even reacts. We don't know, there's two antibodies, one that goes up immediately once you get infected, and one that goes up later and tells us that you are immune to it. We don't know how quickly this goes up or down, the initial one. We don't know how quickly the second one goes up or down, and how long that will last, how much antibody we need to be immune. We don't know that everybody who has COVID-19 develops antibodies. So there's just a lot of questions. But again, we're watching, we're researching, our providers around here are researching, and we're just making sure that we have all the information, and we only want to be able to provide accurate information to you.
Yeah. But I truly hope that we're able to do antibody testing accurately sooner rather than later.
You go back to that one, you think, or so?
That one?
Yeah,
that's the one I just wrote down.
Oh, okay. Yeah. So there was a question about how we're going to roll out phase 1 for Wilson County, or when? How? So how? When?
Yeah.
How/when? So most likely. Because we are getting official guidance, so everything we've heard so far is like through webinars and through conference calls and everything, guidance from the governor, but it's still like not in writing, right? So we're taking notes, we're figuring all this stuff out, and so what we are going to find out on Thursday evening is what we heard is that they're going to like unveil the official guidance from the governor, and so then. What Destiny and I will do, probably Thursday night, is
and most of the day
and
Friday.
Also Friday, is to go back through the plan that we've developed, that we've been tweaking along the way, and then what we're going to do is we're going to say, okay, does ours fit with the Kansas plan? It already fits like what we think is good for Wilson County, and again, we're not just like making up this is good for you. It's taking into account businesses and activities and things like that. So we are going to take that guidance from the state, apply it to what we have for the county, and then eventually what we're going to do, hopefully on Friday would be our plan, that on Friday we would be able to tell everybody what our plans are for phase 1, phase 2, phase 3.
And we are assuming that phase 1 will likely begin on May 4th.
Yeah, on Monday.
Yeah, May 4th.
As in, may the 4th be with you.
Yes, in fact, I don't know if Bob is watching or not, but he wanted to call that the Star Wars phase.
Yes, which feel free to do that if you'd like. Yes.
Yeah.
So that's kind of what it's going to look like, and we're going to do it as soon as possible. If we need to, if it's more complicated than what we can just put on a piece of paper and make sure that everybody understands, we can do this again. We want to keep everybody as informed as possible, and we want to keep people safe. One thing we can tell you is we're not stopping social distancing anytime soon, meaning when you are in public, you want to stay 6 feet away from each other. We want people to wear masks. We still are hearing that people aren't wearing masks in public. Please, please, please wear masks. Probably the people listening right now are the ones wearing masks, but
Pass it on.
Pass it on.
Yeah.
And so we're going to continue to do those things. We're still going to have mass gathering limitations also. So it's not going to be kind of a free-for-all anyways. So, let's see.
Not yet, right?
Oh, a reinfection. Oh, so a question about reinfection, and that comes up a lot because at first we were saying, no, you get an infection, you build the antibodies, and you should be fine. But like we've said before, we have the luxury, if we want to call it that, of being able to see other states and other countries and see what happens there. So definitely in other countries, we're seeing reinfection happen. And now we don't know what that looks like, if it's severe disease or mild disease, and what the patient had to start with. Did they have mild disease? So we still have a lot of information to gather there.
Yeah, and I mean, we would hope that with infection, you would gain antibodies. So with a second infection, you would develop mild disease, but we don't know that.
People talk about, we've talked about herd immunity, things like that. That does happen when there's a certain number, it should happen anyways, when there's a certain number of people who have been infected in a community. The problem with coronavirus, or COVID-19, is that in order to develop herd immunity, we've got to get a lot of people sick, and potentially a good percentage of those people would die or have severe illness. So that's why some of that discussion, I mean, it's out there, and we know that people are discussing this, but that's the drawback of it, is why we're not just saying everybody go get sick, and so
like
that we can,
like chickenpox parties.
Yeah.
We don't.
Yeah, we don't encourage those either. No.
No.
So we want people to stay healthy, and we want to get through this together and have the least amount of lost lives possible, really, is what it comes down to.
Yeah. And I do think that one other thing I was going to mention is the way our plan is written out, it has all the phases listed out and what changes from one phase to the next. Oh, Ohio.
Hiya.
The governor's is not that way. It's not going to be that way.
They're going to release it one at a time, right?
They're going to release theirs one at a time. So that's something that Jen and I need to discuss, whether we want to release ours like it is. It's so pretty.
It is
I
really
hate to
pretty.
change it. It's
And
such a
people
nice
said-
document.
I know, other counties have said, like, this is so great. We're going to base ours on yours, or we're going to take your ideas. That's great. This is teamwork.
Yeah.
It's everybody's first pandemic that I'm pretty sure of. Well, like, really big pandemic, so anyways.
Since H1N1.
Yeah, since H1N1, But so it is definitely a working document. So even if we do, I guess we should say, even if we do release it, we know that things can change very, very quickly and very easily. So we're going to ask you guys to bear with us and say, hey, we're doing our best to get things going, but keep people safe.
Yeah, and we know you guys want to plan things. We want to plan things.
Yes.
I turned 40 this year. I'm going to harp on that forever.
Yes.
I had to take a break from school, and I want to go back and finish up. I have 16 weeks left, and I want to be done.
And I want to plan Sausage Fest for Destiny's birthday, because it's around the same time.
Yeah. So we want to plan things too, and trust me, I feel you. We want the fair committee to be able to plan the fair, and
we want graduation to happen.
Yes,
all
and
these things.
so many things. We want businesses to know when they can reopen and what their limitations are going to be, and what they're going to be expected to do. And so just remember that we want that too.
So we're going to try
and
our
we
best.
will try our best to give you the most information that we can give you in what our plans are, and just realize that they might change.
So an example might be that we say, hey, in phase 1, we're going to, say that and this is just an example, because I know people are asking about like salons, and that's kind of a big deal. We're going to allow salons to open, but with these restrictions, right? And so let's say we go to phase 2, and then the governor says that in phase 2, I don't know, we can't relax that anymore. But in our phases, we said, oh yeah, they can have more people in the salon at one time. But the governor says, nope, you got to stick with the same guidelines from phase 1 for salons. So we would have to go back and say, sorry, we thought we were going to be able to keep relaxing these rules, but we're not going to be able to after all. So that's where things could come up, where we have to like switch gears at the end, because we still have to abide by the state rules.
Just because there are plans doesn't mean that the governor is going to make the same decisions that we are, and we have to go by her rules. One other thing, since Jen said these restrictions on specifically salons, but in our phasing out document, we mention a lot of you have to record who is here. You have to not necessarily sign in, but by appointment only, and we need a register of who has been there and who hasn't. And we want to be really clear, that's not because we want to be in your business.
We don't want to be up in your business.
No, we aren't even going to look at it unless someone is sick and someone tests positive, and then we need to be able to go back and contact all the people that they were around. And that is why we are requesting that information, because say Jen goes to get her, I saw Curtis said he wants to open next week. So if Curtis goes and gets a high and tight, or if Jen goes to Curtis and gets a high and tight, and then comes down with COVID-19, we're going to need to get a hold of everyone she was in contact with. And if she's signing in all over town, then we know exactly who she was around. So that is why we're asking for that information.
Yes. And yeah, so don't be surprised. And don't be surprised if you are asked screening questions, when you walk into, a store or something like that, because we need the people who are helping you out, and we're just going to keep using salons because I think that's the easiest one. But we want the people who are cutting your hair and giving me a high and tight. I don't actually know what that looks like, but it's
like an army haircut.
Oh, that's going to be good. Stay tuned next week. But we want those people to be safe. We want Curtis to be safe, And so we're going to be asking people in certain situations to ask screening questions, such as, have you had a fever lately? Do you have any of these symptoms? And if the answer is no, great. But if the answer is yes, then we're going to say, sorry, this isn't something you could do. We don't want you in close proximity with Curtis right now, because you could get him sick. And we're going to ask people to wear masks. I mean, that's going to be, we're really going to be pushing it more, not just please do it because it's the right thing to do. It's going to be, if you want to have these services or go to these newly open places, then we have to be wearing masks.
Yeah, because we don't want to just, if we wear masks, then we can contain the spread, hopefully, and we don't have to back up phases, because we don't want to back up phases.
So Kylene, and I apologize, you had asked me about the library.
Yes, I'm sorry.
No, we are still, again, we're waiting on guidance, I think, from the state on that, because that is a tricky one. We want people reading. Mm-hmm. I mean, that's a thing. So, and for like Mark Price, our doctor from New York, like some people like him need to learn to read. And so libraries would be good. Just kidding, Mark. So we want to make sure that everybody's safe, like the kids are safe and all of that. So we will get back to you on that. We don't have the answers for you right now, but we're watching very closely.
Yep.
Alrighty. And Curtis, thank you for thinking ahead. I mean, this is what we found in Wilson County, is that people are thinking ahead. They're not thinking like, okay, I'm just going to open and let everybody in. They're already thinking ahead to what they can do to make it safe for people. So thank you so much. That's going to make life easier for everybody. So now, having said that, there may be tighter regulations than what you're proposing, and so by the state. We don't know. So we don't know. So please be ready for that also. But we really do appreciate people and businesses, everybody just already asking us questions and asking what we think, if this would be possible, if this will keep people safe. So thank you so much.
And you wanted to know what questions to ask. We'll create a document and we will push it out to the Chambers of Commerce and on Facebook and everywhere that we can to get all those questions covered.
And Kelly, you asked about if we could mandate masks, like if you're going into public places. That is something that we're looking into and seeing if we're able to do that. We would really actually like to, especially for services where people are in close proximity. Again, like our local barbers, we want to keep them safe. And the masks that people are wearing, the cloth face coverings, those are going to protect people like Curtis from the customer's droplets. They're not going to protect the customer necessarily, but Curtis would probably be wearing a mask also, I would assume. So they'll protect each other, and we're going to hopefully make that happen.
Yeah. I mean, obviously we would prefer people to just do it rather than mandate it, but if we have to mandate it, that is something that, well, I say we, something Jennifer can mandate. I can't mandate anything.
Oh man. And we're not mandate happy, I promise you. Like,
No.
we haven't been so far. We've mandated what the state has mandated, you know, and then given recommendations, and truly we've really just kind of worked with businesses and churches and everything in the community, so it doesn't have to end up being something where people feel like they're forced to do something. Yeah. We've had, just every time we say it, we've had such great people in this community willing to do their part to keep people safe.
Absolutely.
Let's see, masks at stores, potentially masks at stores. We are discussing that and what that looks like and what the state will guide us on also. Let's see, what other questions do we have? There was a question about. Oh yeah, go ahead. Oh no,
Janae asked a really good question about peaks. She says, is it possible that Kansas won't have a true peak due to the rural nature of the state? As in, we'll see peaks at different times in different parts of the state, and I would think absolutely. And I think it will be that way nationwide. I think we'll see, like we saw a peak in Washington State and a peak in New York, and now we think Kansas might be reaching its peak. I truly think that will be the case. I think we'll see waves of it kind of come and go across the country.
And another thing, speaking of peaks across the state, Ford County is one that has been been kind of the focus of Kansas right now. So we have meatpacking plants out there where the numbers of positive cases out there are just skyrocketing. And so really over the last week, and you talked about it a little bit earlier, that we're seeing numbers equivalent to like Wyandotte County and Johnson County in like Dodge City. That's where Ford County is. And so just to touch back on that, one of the important things that we want to stress as businesses do reopen is that, and this is not saying that anybody in Ford County did anything wrong. It's just a good learning point for us that when businesses do reopen, or if you're already open in your essential business, then please, please, please do everything you can to keep your employees safe. Because if we are open, that's great, but if you're not keeping your employees 6 feet apart, or having them wear masks, or closing your break room so that people aren't congregating in one place. I mean, if you're not doing those things to keep them safe, then we're not protecting our employees. If somebody is sick and they have a fever or anything, please, 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 employers, be very lenient with them and let them go home. It's what needs to happen. If they need to be tested, we will determine that through their primary care doctors. But we want to make sure that the environments in each of those businesses are ones that allow people to feel comfortable with staying home if they need to stay home, and comfortable with coming to work and knowing that they aren't going to be put in harm's way.
Yes, and another word that we use a lot and with more increasingly is the word cohorts. We want to keep people in cohorts. So like you see Jen and I together a lot. But we're really not around other people that much. So yeah, we're around each other way too much.
It's a thing. It's a thing that's happening. We're becoming the same person.
We're symbiotic. That's my science
Somebody
word
detach us when we phase out.
Yeah. So that means, and I know that they're using cohorting in the childcare center. It's keeping the same kids together every day, so that you're not like introducing different kids to different groups all the time and making people sick. And you can, hopefully, that's one of the suggestions that we have for work, is that you can cohort your employees. If your company relies on shift work, you keep the shifts steady and stable, and you have the same people working on the same shift. So that way, if a whole shift gets infected, then you have everybody else to cover for them, and you don't have everybody get infected.
Yep, absolutely. And your natural cohorts are like your household, the people that you're already with at this point. So yeah, if we can keep the same people together, we can limit the spread of COVID.
Yeah. And there was a question about the 10-person limit for mass gatherings. The governor's office was very clear that phases 1, 2, and 3 will have mass gathering limits. We have not heard yet what those numbers are.
And it's possible that the first phase, like as of Monday, might still be a 10-person gathering. It's very possible. So,
and, it wasn't ours.
Oh yes, it wasn't ours. So
I think we can say that.
Yeah, I think we can. Yeah, because you said it, you did it,
did.
and that's okay. And please don't mistake our hesitance from sharing all this information as something where we're trying to keep anything from anyone. As we stated many times, we have no reason to hold anything back. We're being very transparent. We just don't want to confuse anyone.
That's
really.
it. We don't want to say 10 people, and then the governor comes out and says 25, and then people are like, well, I thought it was 10, and I thought it was 25, and we just don't want that kind of confusion. So like Jen said, please don't mistake us. We're not trying to be elusive with our answers. We're just trying not to confuse people.
And the reason it will likely stay 10 people as of Monday is because if we are also reopening some services and businesses, then we want to do, like we talked about, like baby steps, especially at the beginning, to make sure that everybody's okay. So if you reopened a whole bunch of services and then you also say, okay, there's a 50-person mass gathering limit, well then you run a much higher risk of spreading COVID than if you were to do one or the other, All right. 10-person mandate. Oh, a thing I keep forgetting to mention is that in Ford County, we know that there is a lot of the meat packing plants. That is where a lot of our meat is I want to say produced. What's the word for meat being made? I don't know. Let's go on. Supplied, maybe? I don't know. Anyways, the point is, there's lots of meat there. The Secretary of Agriculture in Kansas said that there are no known food safety issues with COVID-19. So please don't let that be something where you're like, oh my gosh, the meat packing plants are infected, and so now my meat will be also. No, we're not seeing that, and we're not actually seeing that in the world. So eat meat, unless you're not into eating meat.
Unless you're vegan, then don't eat meat, eat beans.
Yes. We're not trying to change your mind. Eat whatever you want to eat. Processed. It's meat's processed. Thank you guys. You guys are so helpful for us. Thank you.
Even though you guys say hot chocolate.
I know. I think hot chocolate won. I just want to point that out, right? Not cocoa. Let's see. Process. Counties can. Oh yes, counties can be stricter than the state, but they cannot be less strict. Is what we have there.
Which is really the general rule
of anything.
Because
also, like when we put forth our county rules, a business can choose to be stricter, but they can't be less strict. So if they say, no, we will only allow 6 employees working at one time or in the building at once, okay, that's fine. But they can't be less strict and say that we're going to have 50 employees there.
Yeah.
So, same thing. All right, other questions? Thank you guys. I know we get guests as we're watching people roll in, and it shows people are watching. I see Mary from Ohio, Dr. Mary. So and we see Mary Krebs. Sorry, I'm like, Dr. Mary. That's not your last name. But we see people from Ohio, from New York. I saw some of my family from the Philippines. That was nice, and people from Texas. So we've got lots of people, and of course, near and dear to our hearts, we have all the people from Wilson County and people who used to live in Wilson County. You're forever. Technically Wilson Countyers. We'll keep you.
Okay, so Wendy Gayu has a really good question. Should people still postpone routine medical procedures like yearly physicals, skin checks, mammograms, or just go ahead and schedule them?
Ooh, let me answer that one.
Go for it.
So in our plans, and I believe what the case is throughout the state, the hospitals themselves and the healthcare systems are developing their own guidelines, as in when they feel comfortable. And the reason is not just to say, okay, let's just do a whole bunch of surgery so we can make a lot of money or whatever. It's to say, do you have enough beds in case your numbers of COVID go up? Do you have enough PPE to protect people during those surgeries, during those other procedures, during radiological procedures? Do you have enough tests in order to test people? Because some people are testing before each procedure. And so there's a lot that goes into it. So it's a really great question. My number one thing would be make sure you're still contacting your primary care doctors, because people still have high blood pressure, high diabetes, kids still need their well visits, kids still need their vaccinations, and we are seeing those numbers drop. And so please, please, please make sure you're taking care of all of that stuff. And then second, check with your hospital, check with your primary care doctor, and then that will allow you to figure out whether you can get a mammogram scheduled or whatever else. I don't believe places are doing a lot of screening things like mammograms at this time, but we are starting to do more as we go along. Procedures, labs, things like stress tests, things like colonoscopies. If anyone needs a colonoscopy, we'll be doing those eventually. Not yet, but
yeah.
please.
But those things are very important. Those preventative procedures, they are still important. And we don't want you to completely stop doing them. In our educated opinion, do you see us being able to have the fair and go back to school in August? Please say yes. I'm assuming that please say yes is school. But I think we can honestly say we hope so.
But we don't know.
We don't know. And that's such a hard answer. We really want the fair, and we really want our kids to go back to school. But
John Boss volunteered to take all of our kids back to school, which is really great. So thank you very much.
Yeah, he's just going to school in his backyard.
Yeah, just give him to John Boss in small gatherings, in cohorts. Way earlier on.
Oh, gotcha.
He wants his germ monsters back.
His germ monsters.
I like it. But yes, we do want that to happen. And what that depends on is what the next few weeks and months look like, because if we do things right and safely, then we're going to be able to continue to move forward so we can open up more and more and more. And if we don't do things safely, then we are going to end up right back where we are. Yeah. So that's where this part is really going to take everybody. It's taken everybody to do this stay-at-home mandate and to wear masks and things like that. And still lots of comments every week about people not wearing masks. So please, please, please wear masks in public. But it's going to really take a lot of effort to get people, to go with each phase and make sure that we're not doing more and potentially hurting each other.
Yes. You're right, Diane. Those winds were crazy.
And the hail, that was messed up stuff yesterday.
Yeah.
I don't know.
Crazy weather.
We kind of decided, someone somewhere is like, hey, we gave you COVID and you guys are doing a really good job with that, so we're going to throw some really bad weather at you because it doesn't seem to be a challenge.
Right.
We don't know if that's true, but it could be. We don't know. Who are we to know? Meatball and Matthew are best buddies. I love it. Let's see. Thank you. Such nice things, you guys. What else? Any other questions? There was something I was thinking of as we were going along, and I can't remember. Oh well. So the biggest thing that you'll hear from us in the next few days actually is just that what it looks like to reopen. Summer rec activities, that's actually part of our plan as well, figuring out how we can enroll that safely too. So hopefully you guys hear the message from us is that we oftentimes are seen as kind of the bad guys because we're saying don't do this, don't do that. And I'll get to that one. And the truth is that, like, let's say this last week, and we're going to keep saying it through this weekend, we don't really want people doing cruise routes, for example, right? Organized cruise routes. If you're in your cohort, and your family does a thing, okay. But the problem with some of these cruise routes in the past is that people get out of their cars, they start congregating, we stop at more places like gas stations or at restaurants. And so even with the best intentions, people still have to fill up with gas, or somebody might get hungry. So we have more people out and about at the same time, touching the same things. Again, not meant to be anything, we're all about Fredonia Pride and Wilson County Pride and all of that. But we know that it increases, the touches on things in the community, which can increase spread. So we're not meaning to be jerks. This applies to us too. We shouldn't be jerks, and we're not meaning to be. We just want to keep people safe.
Yeah. And the same thing with the pools. KDHE has promised a guidance for pools, but that's
sure.
forthcoming. And then, you know, we, like Jen said, we do the serology testing.
Oh, Mark, fine. We did talk about serology testing a bit. I mean, and I think you're meaning antibody testing, yes? Mark, if you answer that one. But we mentioned that a little bit earlier, that we are not at this time recommending it, but we are watching very closely to see how the technology improves so that when we do offer a test, that it's one that we know the answers to, what it means when somebody has this antibody or this antibody, and we know for certain what that means, or reasonable certainty. And until we get to that point, we're not recommending it. And so if people do ask about it, we just share that with them. We want to offer you good tests with good information and results that we know are accurate. And until then we want to do no harm in doing tests that might be misleading.
Kathy, we want Rick's to open up by May 19th as well.
And we saw Rick's on here. Our restaurants are doing an amazing job. Some have had to close down temporarily, but with delivery and takeout, my goodness, that's a good thing.
Yeah.
Yes.
And Rick called me Monday, and I spoke with him Monday, and he's anxious to open, and we're anxious to get him open, and he is fully willing to do it in a safe way. And yeah. No, we love our restaurants. I'm so sick of cooking.
All right, we will do our last call. Vicki, that's what we're hearing too, is that people aren't wearing masks, and we'd love for people to wear masks. So this is a time where it's like, hey, where's your mask? Like, that's an okay question to ask, and so we're going to be pushing that.
Don't be mean.
Don't be mean.
Don't be jerks. We don't want anyone to be mean.
Don't be jerks. Let the viruses be jerks. Mm-hmm. But we can ask questions and try to help people. Help each other. Okay, last call for questions. Like we said, we're going to be here every week, Tuesday at 5:30, and we will be unrolling this information for reopening, hopefully on Friday. We'll probably be spending a lot of time together this weekend, Destiny. Please, someone send us food, maybe even adult beverages, if you feel so inclined.
Depends on how loose you want that plan to be.
We can't take bribes on this show. We can't. Wink, wink. Oh, not good. My winks look like this. Oh no, I'm so
Winking
bad
with both eyes.
I know. I think it's just blinking now.
Yeah.
Okay, so thank you guys.
The pool, Wendy. The pool. We don't know yet. Hopefully, we really hope that the pool can open around Labor Day when it generally opens. We don't have an answer for that yet, though.
And the state's going to give us guidance on that one, supposedly, is what they tell us.
Yes.
So.
And if you didn't get enough tonight, go watch us with Dr. Norman, because we sounded really smart.
And the filter.
Yeah, he made our face look nice.
So yes, go to the KDHE website, or go to our, not website, well, also website, I think, but, maybe just Facebook page. Anyways, and our Facebook page, either of ours, and we have our video where it's just us and Dr. Norman. We're the ones without the mustache, just in case you weren't sure. And so he interviewed us, we got to interview him, and it was a super cool time, and we got to talk about why we love our rural community, why it's a blessing to us to be able to know people inside and out, and be able to care for people in a very meaningful way. And not that doesn't happen in urban areas. It's just we know in our communities, basically everybody's
we know related. You guys better than they know their people, and that's what we love about this county, because we know you and you know us, and so
yes. And I'm pretty sure we've known each other for at least like 35 years, which is crazy since we're only 25.
I know, right?
Yeah, it's so pandemic math doesn't work exactly the same. So we love you guys. Check on each other. Please be careful out there. Please wear masks. And
reach out to us if you have any questions.
We are here for you. Have a good night.
Thanks.
See you next Tuesday.
Yep. Bye.